Hello there. Nearly 1.2 million NHS patients are waiting for 6 months or more for vital medical services in England alone. Where is the government plan? As per usual, please like, subscribe and comment below. And when subscribing, please press the little bell, but also select the all option, or you won't get any notifications. So it looks like the NHS is closed for business to peasants like us, unless you have COVID of course, as 1.2 million people are right now waiting for at least 6 months to get access to vital services in England alone. But you can always pay to go private and avoid the queues of the great unwashed. That's right folks, people are unable to get vital treatment and diagnosis right now due to the shutting down of large sections of the NHS in order to protect lives at the height of the pandemic. This has created a huge backlog, meaning that 1.2 million people are facing a choice: sell all you own to go private, or wait for at least another 6 months on the NHS to maybe get an appointment if you're lucky or if you're still alive. Of course, none of these things affect Boris Johnson and his cohorts because they can afford to go private or even to another country for treatment. Don't think for one moment that if someone like Stanley Johnson had a hernia picking up a crate of champagne that he would have to wait 6 months for an appointment. Oh no, with a wave of a credit card he would be seen that afternoon and probably be operated on the next day. However, for the rest of us who are unlucky enough to have need of the NHS outside of a positive COVID test, I'm afraid it's make your peace with God time. Sorry, but it's time to get upset. Why are we paying for a health service that doesn't even deliver the same level of service that it did 30 years ago? Please don't tell me it's about saving the NHS. That was the job of the unused Nightingale hospitals, and they very quickly became a thing of the past, having never housed more than a handful of patients. Yet the rest of the NHS was shut down, with hospitals not performing routine operations in order to stop the spread of COVID, while we all clapped like seals. And now we have 1.2 million people on a waiting list for vital services. And the projections are that there could be up to 14 million people on all the NHS waiting lists by next autumn. 14 million. And there were already 4 million on those waiting lists before COVID-19 struck, because there was already insufficient capacity to deal with them. Here's what the Telegraph reported last April. The number of people being admitted for routine treatment in England, for instance, is down by 47% in a year, and nearly 330,000 have been waiting more than 6 weeks for a key diagnostic test. Urgent cancer referrals by GPs are down 8%. It is likely that when people are finally examined and diagnosed, their illness will be more advanced, requiring more drastic therapy. There is even anecdotal evidence of patients showing up to A&E with late-stage cancer. I'm sorry, did nobody see this coming? We were told by the propagandists in Imperial College that if COVID was to let rip, there would be in excess of 600,000 deaths, a figure that has been highly contested since it was first released by a man who was so convinced of the dangers of spreading COVID that he flouted the rules himself to play hide the sausage. But how does 600,000 possible deaths compare with those potentially passing away while on the waiting lists for vital services, and those that died due to being unable or too scared to access urgent medical services in the NHS? As I write this, I am painfully aware of a grandfather whose baby granddaughter was unable to receive a cancer diagnosis last year, and is only now able to gain access to something resembling the treatment and care she should have had last year. Since when was it okay to demand that kids have to shield adults? Since when did that ever become an acceptable moral stance? what kind of generation demands that their children stand in harm's way for their benefit? Now, before I continue, I just want to say a massive thank you to all my Patreon and PayPal supporters, as well as those that buy a mug with my mug on it, link in the descriptions box below. You really do help me keep this channel going. From the first moment we set out to flatten the curve and save the NHS, this backlog of patients was always inevitable. When you empty hospitals and surgeries because social distancing takes up 3 or 4 times more space between patients and beds than before, then you end up only being able to service 1/3 or 1/4 of the patients than you did. Couple that in with just one doctor or nurse testing positive, and a whole team of specialists could be ordered home to self-isolate, further depleting resources. Now, when the pandemic hit, the NHS would have been working at near capacity anyway. There will not have been much scope for a heavier workload, hence the call to protect the NHS. But as soon as the first operations and consultations were abandoned, then the backlog started to quickly build up, on top of the already 4 million on the lists. And the thing that most people don't realise is that just returning the NHS to normal running conditions will not help deal with that backlog. 100% of normal performance will not suffice, and rejigging timetables and small efficiencies of a couple of percent here and there will not cut the mustard either. Because as fast as you deal with people on the waiting lists, more and more new patients are pouring through the doors at pre-COVID rates. The only way to deal with such a huge backlog is to vastly increase total NHS capacity until the backlog is gone, or else the most you can expect is a gradual erosion over many, many years. But the most important element of NHS capacity is trained staff that have not been burnt out by COVID-19. Have we got the numbers? And we've already mobilised as many retirees and the like that we can using 2020 Coronavirus Act clauses. Now, there has been talk of roping in the private sector, but some people don't realise that by going private, you'll very probably be seeing exactly the same doctor or surgeon you are seeing in the NHS. And while they're doing the work privately, they are not doing the work in the NHS. The only difference is they'll now get paid more. Now, according to iNews, the government is in talks with private healthcare operators to free up thousands of NHS beds for those in more urgent need of care over the winter months and cut ballooning waiting lists. A wave of new deals between the NHS and independent hospital firms are expected to cost the taxpayer more than £2 billion, with the contracts allowing almost £200 million in profits for the health providers. And according to the report, this will give the NHS an extra 7,000 beds. Now, private health companies do not get fat on profits from keeping thousands of beds empty. And a bed means more than just a room bedstead, mattress and pillow. It also includes all the staff and equipment that is needed to make it work. So where are those who would normally be occupying those 7,000 private beds going to go? Into the NHS to fill up those 7,000 freed up beds? Or are we saying that UK private healthcare companies have access to thousands of so far unused doctors and nurses, as well as real estate ready to put it all on? Or have we just paid private health companies billions to better match patient need to available service while keeping the actual bed numbers the same, but while reducing the scope for some people to go private? Would be good to know the answer to that one. Now, the moaning remainers and rejoiners will no doubt soon be demanding that we let loads of EU doctors and nurses in to do all the work, as well as trawling around the world for them. But just about every other country on the planet is in exactly the same hole as we are. Many much worse. and it would cause a lot of acrimony were the UK to get out its big, fat, colonialist NHS chequebook to selfishly buy them all in, to leave their own citizens in the lurch. There is a worldwide shortage of healthcare professionals after all. Now the waiting lists will keep lengthening until the NHS is operating at 100% of pre-Covid capacity. Then it will stay the same size until capacity is ramped up well above 100%, and only then will the waiting lists start to come down. My hunch is those backlogs are here for a long time to come. So what's your opinion on these waiting lists? Please like and comment below.